sphenopalatine foramen to get into the PPF, and then goes all the way down to the incisive foramen and exits through there.
Mesopalatine nerve goes through.
Anyway.
Goes through your sphenopalatine.
Madison, did you have somebody had the back there their hand up? No? Thank you. Yes.
Incisive.
The question is, can you see cranial nerve 9 after you see it with the stylopharyngeus? And the only other place you could potentially see it is on the back of the tongue, but past where the stylopharyngeus is, the answer is no. You can see proximal, but not distal. Yes, ma'am.
The deep protrusal, do you know where that's coming from?
I would say not so big, but where is it coming from? Where would its post-ganglionic cell body be located? Superior cervical ganglion, travels with the carotid. Tilly's going to come off from that pathway. But no, I understand where you're coming from. No. Anything else? Yes, sir.
I think in lab it just had for one of the terms like palatine vessels.
That's a great question. But obviously you're not the first person who's asked me that one. I don't even know why it says palatine vessels. All I really care that you know about, first off, veins, don't worry about those at all. So what you have there, I don't think I've got the artery coming up. But anyway, pretend we've got something that looks just like this, because it kind of would. So you would have the maxillary artery, you would see a branch coming off that would be the descending palatine artery, and then if you follow it down, you can see where it splits going anterior to posterior into the greater palatine artery or the lesser palatine artery. Okay, that's what I would say is all you have to know. If somebody tagged and said greater palatine, or said the palatine vessels, I probably wouldn't count it wrong. Okay, just because it's on your list, I'm sure there's people who've learned it that way. There's probably somebody who's not here today who would come back to my office later and say it was on there. Yes, ma'am.
If in the notes it just says superior alveolar and it doesn't specify like P, M, or A, which one?
Doesn't it say superior alveolar AA?
No.
It just says 1A? Yeah. It's saying it's the superior alveolar arteries. So PSA, MSA, ASA. It's more than one. Okay. I would make sure that I knew what structures drain into which meatus or space. And you know that inferior meatus gets just the nasolacrimal duct, sphenoethmoidal recess, sphenoid sinus. Superior meatus gets posterior ethmoidal air cells. Anything else goes into middle meatus. Know that middle meatus also has where the ethmoidal bulla, hiatus semilunaris are located. That should be nothing. Okay, our good friend, the PPF. Okay, I know this will thrill everybody, but of all the spaces, I would make sure I knew walls of the PPF and their openings and what travels through them. Okay? So most of it's pretty straightforward. You should know the anterior wall that has the inferior orbital fissure on it. Inferior orbital fissure has the infraorbital band and the zygomatic nerve traveling through it. Alright? The medial wall has the sphenopalatine foramen, so what's going through there? Nasopalatine nerve, sphenopalatine artery. Posterior wall has these three structures on the posterior wall, so rotundum has V2 going through it. Pterygoid canal has nerve and artery of the pterygoid canal going through it. Pharyngeal canal has the nerve and artery of the pharyngeal canal going through it. Lateral wall's got the pterygomaxillary fissure, so it's got the maxillary artery traveling through, but then the PSA artery and nerve coming back through the other way. The floor has the palatine canal, so this is how the PPF communicates with the oral cavity by things going through the palatine canal. And as far as I remember, we didn't give you anything for the roof, did we? Thank goodness. So much else to learn there. Okay, so make sure you understand in those different directions how the PPF communicates, so you know that through the inferior orbital fissure it's communicating with the orbit, through the sphenopalatine foramen it's communicating with the nasal cavity, through the posterior wall it's communicating with either the intracranial cavity or pharynx, through its lateral wall it communicates with the infratemporal fossa, through the floor it communicates with the oral cavity. So again, it's also a matter of knowing what's traveling through, going to where.
What's that B2?
I think that's why I brought this back up again.
Comes through
It's all good.
B2
Maxillary
comes through
artery,
about-
this is just one of those things that you gotta know from the review stuff, from the new stuff. Go back to infratemporal fossa, make sure you understand about the branches located within the infratemporal fossa. That would probably help you relative to the gunshot. Make sure you know pterygopalatine fossa, how basically maxillary artery comes in, it gives off multiple branches. One that comes back out, going to the maxillary tuberosity, PSA, and really this is lab too. I don't think these are as hard as what people make them to be, because if you think of where they're going to, it shouldn't be bad. One comes off infraorbital, should be easy enough to see. One comes off and goes inferiorly, descending palatine artery, and then, holy smokes, going the wrong direction, Spears. One comes off, but instead of doing this in the lab, you're going to see it as a cut nub right there, sphenopalatine artery, and those are the only four that you've got to know in laboratory. Alright? Yes, it also gives a pterygoid branch and a pharyngeal branch, but lab, you don't have to know those. Okay, still staying kind of with that pterygopalatine fossa area, let's talk about V2, because this is where we're really following V2 coming through here. And there's a couple things I want you to be aware of relative to this. So you know that V2 came through foramen rotundum, came into the pterygopalatine fossa, and then started giving off branches. Alright, you know it gave off, first off, these are V2 branches, direct V2 branches, excuse me, let me make sure people understand that. It will give off greater and lesser palatine, give off those lateral nasals we talked about, and then it's also going to give off PSA and zygomatic. Zygomatic coming off, we'll head to the lateral wall of the orbit, PSA, going back out the pterygomaxillary fissure, going to the maxillary tuberosity. So after it gives off zygomatic PSA, the nerve will become the infraorbital nerve. So infraorbital and zygomatic go through the inferior orbital fissure, and as the infraorbital nerve travels through the maxillary sinus, it gives off two direct branches, MSA, ASA. Yes, sir?
I'm sorry, at what point exactly did you say it becomes an infraorbital?
I wouldn't worry so much about the point, just understand if there's a lesion at the infraorbital, you know it's got to be inferior orbital fissure, it's got to be just the infraorbital nerve and zygomatic nerve now. Okay? After zygomatic and PSA comes off, it's going to become infraorbital. There's no specific point. Pretty variable.
Thanks.
PSA supplies innervation to the maxillary molars. MSA is going to the maxillary premolars. ASA is going to the maxillary canine and incisors. MSA, ASA, direct branches off of infraorbital. It still makes them V2 nerve branches, just a difference between direct versus indirect. Yes, ma'am?
You could just show the tracing like after the PSA comes off of it, how it's like the zygomatic and the infraorbital and the foramen.
Talking about this thing going up like this,
I don't know.
or whatever the zygomatic nerve does. Hang tight and I'll talk about it in just a second. Make sure you understand, particularly lab-wise, when you're looking at that head and you look at the maxillary sinus, MSA should be a nerve that comes off and almost bisects, goes right down the middle of the maxillary sinus. It will kind of be in the mucosa of the wall. ASA comes off much more anteriorly, going down, kind of same thing in the mucosa of the wall. Yes, Logan?
You said infraorbital, like at the infraorbital fissure, if there's
At the infraorbital fissure, if you have a lesion there, a tumor, something,
It's not a
you
tumor.
would get both the infraorbital structures and zygomatic. That's what goes through the infraorbital fissure. Yes, ma'am?
You mentioned the lateral nasal as a direct branch. Isn't that the nasal? And it turns into lateral nasal and then nasal?
Just think the lateral nasals as being direct branches off of V2 and you're fine. If you just think the nasals are, there are branches off of V2 that are nasal branches, you'll be fine.
But
Just
I
call
just
them
thought
lateral
the
nasal or
branches
nasal.
off and then it branches into lateral nasal and.
If you wanna think of it that way, that would be great.
Is the pharyngeal a direct?
I'm not trying to, I'm just saying, I don't think it's gonna affect anything relative to the test.
And then all the other branches you're saying are not direct branches, they're.
I understand, if I'm emphasizing something about something being direct or not, there's probably a reason. If I'm not, there's probably another reason.
Is pharyngeal a direct branch or not?
Is the pharyngeal nerve a direct? Okay, first off, let me just backtrack here. Whoa. Understand what I've created.
A monster.
What I really want you to know is that everything is coming off of V2 except for MSA, ASA. Okay? Anything else comes off the V2. Okay? MSA, ASA are branches of the infraorbital. They are still part of V2, they just don't come, they're branches of the infraorbital. Okay.
Done.
I'm not down, but I
Done,
understand.
son.
I understand that we write some questions that, maybe would